looking for. Like as providers, we know what it is that we need, right? Like we don't want to be transferring data on Post-it notes. That's just what people feel like they have to do. And so when you see that kind of click with people and it resonates with them and it's what you've been working for towards, I feel like that just feels so good. It's like that little shot of dopamine that's like, yes, that's right. That's why I'm coming here to work every day. This is what I'm doing. Like I am trying to solve hard problems for people. And like, we're starting to see little steps and milestones along the way.
Wow. Well, thank you for
We're looking for.
Nothing in this podcast is intended to render legal, financial, medical, or other professional information. Because the details of your situation are fact-dependent, we highly encourage you to find a recommended individual that you can trust to give you the expertise that you need related to your situation.
Well, good morning or good evening, Docpreneur Nation. You're listening to the Docpreneur Leadership Podcast at Concierge Medicine Today. And today we have a very special guest, Dr. Carolyn Ward. She is with Particle Health, and she is the Director of Clinical Strategy. And I'm going to let her talk about why, her background as an internal medicine physician, but really, we don't have a necessarily a big picture topic we're talking about today. We're going to talk about what Dr. Ward is doing at Particle Health. We're going to talk about AI, but for primary care physicians listening, it's now easier than ever for primary care physicians to access thoughtfully curated data sets from the largest nationwide networks in the United States. And for the specialists listening, Particle Health is fetching data from centers of excellence tied to your patient's conditions and produces outputs designed for clinicians by clinicians. So you'll be able to get fast, secure access to condition-specific health records, insights, and data products. And for me as a patient, I'm sure that means a lot, but for you as a physician listening and Dr. Ward, this is where you guys all geek out. So Dr. Ward, thanks for being with us.
Absolutely happy to be here.
So before we begin, we ask this of all of our guests, what drew you into healthcare at large? Like, was it a family business, or was it a personal story, or you were done wrong and you said, I'm not going to have that happen to me or anyone ever again. I'm going to go become a doctor. What's your story?
I would definitely say my story started pretty early in life, in the sense that I was always really curious and always trying to learn. So my big thing was like, I would want to learn a lot and get really deep into a lot of different concepts and thoughts and, run science experiments and things like that. And as I grew up and I started to think about like, where do you want to go to college? What do you want to major in? What do you want to do for the next 40, 50 years of your career? I really was looking for something that would be intellectually stimulating. So something that would keep you on your toes, something that you're doing something a little different every single day, something that was going to be challenging. So like the field would always constantly be changing. And then the other thing I was thinking about was I want to have a people-facing role. So there's certainly a lot of jobs that you can do that is challenging intellectually, that you can do like quietly in the comfort of your own house, like at a desk, and not have to speak to another human all day. And then the third thing I think here is impact. So what is the impact I want to leave on the world? And how am I going to make a difference in people's lives? And so medicine is kind of a very unique intersection of all three of those things. And I do think it is one of those unique fields where you can leave every day feeling like you've made a difference, right? You've really impacted somebody's life in a meaningful way almost every day that you practice medicine. And it could be in small ways, but it's still meaningful. And I think that was really important to me. As I was practicing medicine in the healthcare system, though, you realize that your actual job is not what you thought it was going to be, in the sense that you actually do spend a lot of your time sitting quietly by yourself in front of a computer at your desk doing work, right? And it is intellectually stimulating in the sense that like every patient is different. Even if they have the same condition, the way it manifests in them is really different. But you don't really get as much of that chance to have that patient-physician interaction. And it's one of the reasons why there is such a thing as concierge medicine, and why there is such a thing as direct primary care, and why we're seeing a lot of innovation now in care delivery models, because there's a demand in the market from it from a patient perspective. And physicians also, we don't want to be churning out patients every 15 minutes. Like that's not why most people went into healthcare. They went into healthcare because they said they wanted to make meaningful connections with people. And I just don't feel like our healthcare system currently is really set up for that. And so when I was finishing up my training, it was really at the kind of the very, very early start of COVID. And that was also really eye-opening to understand how hospital systems work, how the logistics of it works to get, people staffed in certain areas, to run a hospital, to get equipment, to get PPE. And then also, like, how are you going to get a very small physician population to take care of a suddenly very large influx of patients? And I realized, like, there's got to be a better way for this system to work. And I think that was the first time where I thought, like, hey, I think I actually could leave more impact working on affecting the system itself versus the one-on-one patients that come into my office. And that's ultimately how I ended up at Particle.
Wow. Yeah, we hear a lot of that kind of story where it's like, I wish I could make a bigger impact. And then you know what? I'm really gifted in the business side of things. And I love interviewing those types of physicians who recognize their entrepreneurial tendencies and their business strengths, because the world of business needs, especially in the healthcare bubble, that's so large, needs more physicians, in those roles to impact those places and spaces and faces that need companies and hospitals and for other entities in the form of organizations to help them. And so, um, thank you for sharing your story, and thank you for recognizing your entrepreneurial tendencies, so to speak, and being brave enough, because it is a bit intimidating. Some of the physicians we've interviewed, over the years have said, I didn't know if I could make it and cut it in a business side. Like I'm too annoyed by that. I'm too annoyed by the bureaucracy, and, it takes, 13 days to get a set of paper clips. But small and big businesses each have their challenge. But let's kind of zero or zoom out for a moment, and let's talk about something you're pretty passionate about in the area of the work that you do at Particle Health. And our guest today is Dr. Carolyn Ward. She's the Director of Clinical Strategy at Particle Health. And we'll put the links in the show notes to who Particle Health is and what they're doing. They're not a sponsor. We're not sponsoring anything here. We're not endorsing anything. This is just, we feel as though this is an important topic to address. And Dr. Ward has been kind enough and gracious enough to come talk about it and educate you, physicians listening out there, about what's happening in this field. So let's talk a little bit about, zoom out for those listening, the need for accessible and usable patient data in the healthcare industry. Kind of like, we're going to solve all the world's problems in healthcare. Let's start with this one.
Yeah, absolutely. I mean, there are so many issues to tackle in healthcare, which is why it's so ripe for disruption and for innovation. And to your point, is exactly why we need more physician entrepreneurs and physician executive leaders on this side of the dark side, so to speak, of the industry, to inform those decisions and those products, right? And so one of the things I think a lot about when it comes to clinical data access is patient care today is more fragmented than ever. What do I mean by that? As many of the physicians listening know, your patients don't just go see you as their physician, right? They're probably seeing you. If you're a primary care doc, they're probably seeing you. They're probably seeing some specialists. Those specialists may or may not be part of the health system that you're working in. They're probably seeing like some telehealth provider for, some virtual care. They're probably going to some rando urgent care down the street. And then they're also probably getting hospitalized at a variety of different hospitals. And so when you think about that, each of those places and each of those providers have their own way of keeping data. Most places in the United States now are on an electronic health record, but those electronic health records don't really speak to each other. So even if you had two endpoints of the same brand of EHR, that does not necessarily mean that those two EHRs actually can speak to each other. And so for sure, there isn't really a way for different branded EHRs to speak to each other. And there's so many of them. We hear about Epic and Cerner and Allscripts, but there's actually a ton of like specialty-based EHRs. A lot of the new digital health companies actually have homegrown proprietary software platforms. And so the problem is that as a patient on your care journey, as you're going to these different places and facilities, a little bit of your data is over here, a little bit is over here, a little bit is over there. And every one of these providers that you see only sees one slice of your data pie, if you think about it that way. So all the decisions that they're making are based off of this one little slice that they see. And I think we have the hypothesis at Particle, and I think it's justifiable that if you saw the whole pie, that might actually change quite a bit of your decision making as a provider. And as a provider, we know we operate in a gray space. We're never going to be able to say with 100% certainty pretty much anything in medicine, but it's how gray is it, right? Like, what can I do to add more confidence and mitigate the risk of decisions that I'm making? And the truth is that you need data to do that. And if you don't have it, then you're always kind of operating in an extreme area of uncertainty. And you're always kind of wondering, is there one piece of data out there that if I knew about it, I would not make this decision, or I would change my mind about this medication, or I would say, ooh, this is actually a lot riskier than I thought for this patient. And so the goal of Particle is basically to go out across the national networks and find data for individual patients, collect it from all these facilities, put it together, deduplicate it, cleanse the data, put it into a longitudinal record, and then pass it back to our providers so that they have that full clinical context.
What are patients wanting? I mean, I was having the same conversations, but in a much simpler, dumber way this morning at the bus stop with one of the parents there. And we were talking, because I work in healthcare, he works in tech. We were having the conversation around centralized medical records. And it's like years ago when we saw Google kind of go away from that, I was like, oh man, that kind of stinks. Like I kind of wish they would have stuck with that department. Because we are so fragmented. Like my PCP gets this picture and she gets this slice over here on the specialty side. And then it's our job as patients, but then we ask for that data from our different doctors, and it's like, no. It's not that easy. You can't just ask for that, Mike. Like it's way harder, and it really doesn't even belong to you, is what some people will say. And you're like, it's my stuff. Like I just want and then you have the patient who's, very organized and record keeping, and they bring in the big file and they've been carrying it with them since, 1984. And you're like, wow, I am not going to dive into that today, but tell me what's up. Tell me what's going on.
Yeah.
So what do you
Yeah.
find patients are wanting in the clinics and places you're working with?
I think what patients are really looking for is personalization. And what I mean by that, and I'll kind of put it in the context of our conversation now, is when a patient goes in to see a physician, what they want to know is that that physician knows them as an individual, what has happened to them in the past, what medical conditions they have, what medications they're on, what have they tried, what have they failed, like what is all the data that this person has generated, what does it actually mean? Can we put it together into basically a mental model and say, okay, I understand who you are, where you are in your care journey. And because I understand that, I can have the assurance that I am making a decision that makes sense for the context as you as an individual. And that doesn't really happen today because one, there's really none of that trust building. You think about when you go into a physician's office, you've probably been there like 5 or 6 times already. You're still filling out that 15-page form. And you're like, do you not have this information? Is that like, I'm filling this out and you're throwing this piece of paper away? Like, why do I keep filling this out? And that's not building any trust that that person knows anything about you. And, when you go in to see a physician or you get referred to a specialist and the specialist is like, so what are you coming in here for today? You're like, do you not know? Did you not get any records from my primary who referred me to you? Like, that's not trust building. And so how do I know that you're making the right decision for me when you don't really know like what is going on with me? And then at the same flip side is right now in our healthcare system, the onus is on the patient to be the transporter of your own medical records in your brain, right? So when a physician comes in, we ask them, what's your family history? What have you been diagnosed with? What medications are you on? Any allergies? What did your last physician say to you, right? Like that is literally how we collect information in the healthcare system today. And maybe that works for some people who bring in their 3-ring binder or are very literate in healthcare, or maybe they're a physician, so they know exactly what piece of information I'm looking for and what is important to tell me. But the vast, vast, vast majority of patients do not, and they shouldn't have to. And I think that's the point, right? So we want to get to that level of personalization without it being incumbent on the patient to tell you all the pieces of data and be able to filter for the physician what is the most important piece of data to actually convey. And I think that's a really unfair ask of patients. And so what we really want to do is say, hey, can we take all the data that you have generated throughout the healthcare ecosystem in the United States, and can we put it together into a package in a way that a physician could quickly understand your clinical context? And I'll also say, like, this is like pretty much also enabling something like a digital twin, which a lot of companies are working on now, where you could basically create like a data digital twin of who this person is. And you could start to think about creating like actually predictive models off of that twin to be able to say, okay, based off of everything I know about Carolyn Ward, if we don't intervene, we just let her do whatever she wants to do based off her current habits, what's going to happen to her in 10 years, 20 years, 30 years? What medical conditions is she going to develop? What is going to happen to her? She's going to get hospitalized. And then we can start to get into the realm of saying, okay, if I manipulate parts of this model, if I change some of these variables, what will happen? And today, if you think about it, the practice of medicine is kind of like that, except all that modeling is happening in a physician's brain. And that's very hard to scale because a physician can only ever see a certain number of people per day. And a physician can only ever hold a certain number of data points per patient in their head. So it's really on that individual to know what is the most important. And so we're trying to tackle this from both sides of, one, can we actually gather all the data so you don't have to? But two, can we actually make sense of all this data? Because it's probably too much data for one person to figure out anyways.
That leads kind of more to a futurist type of conversation. And that is, what is, like, I look at physicians in the future more as data scientists, and I'm sure you do as well. And I don't know if you were as intrigued by the 30-second commercial within the last couple of months where Matthew McConaughey was saying, well, if data is do you know what commercial I'm talking about? There's something
No.
about like the gold rush, and then data is kind of like the new gold, right?
Okay. Yep.
And you're kind of like, wow, that is kind of true, kind of accurate. And this talking about the role of physicians in the future as data scientists and less, I mean, there will always be a role for primary care, but as the data and you know, the role of primary care, I think, diminishes over the next few decades as far from a perspective of trust is eroding with patients because we don't know you, we don't like you, we don't trust you because you spend 5 minutes with us, you
Yep.
ask us less than 3 questions, and then healthcare is about a feeling, and then hospitality is a process. But I am a patient and I don't want to feel processed anymore. So I'm going to go wherever it is. If it's a PA that's giving me better care, or if it's the retail clinic or the DPC doctor or the concierge doctor, or wherever, Google, wherever I might be getting better care, I'm going to go there because it's a miserable experience. And it's not a great feeling to go to a doctor anymore. And so as that role of a primary care physician eventually changes, but there will always be some of the where it is now that will always be with us. But as that role changes, what advice do you have for those physicians of the future that are looking forward to the future and saying, we can do a little bit better, but we got to become maybe more data scientists and then direct patients and direct our patients differently and have a different type of visit, have a different type of practice? It's a big question. It's a
Yeah.
big ask.
Yeah. But I think it's a really interesting part of this space right now, because we are seeing like that there's just, as a species, we're generating more data than ever, right? And so one, access to that data and being able to pull it together, yeah, that's a barrier. But assuming we can overcome that barrier, which I feel like Particle has a solution in place for something like that, and you are able to get all this data. Now the question is like, what is useful about this data? How do we make it useful for patients and providers? And when you think about primary care physicians or physicians at large in the United States, in the next 9 to 10 years, we're about to have like a 50,000 person shortage on the provider side. And so that problem's actually only going to get worse, which means that there are not enough physicians in the United States to take care of all the people in the United States. And there's really, in my opinion, no way to scale medical education enough in the next 10 years to actually close that gap. And what that means is, unless we plan on having most people in the United States not having access to healthcare, it means that we're going to need to use tech to scale physicians. And, I'm a primary care physician, so obviously that's where I care the most about. But I think the interesting thing with primary care physicians is we need to have a better way of seeing who that patient is and managing them without having to spend all of our time in the nitty gritty of like gathering data. Right now, physicians primarily work on data gathering, right? So they spend all their time, especially as primary care, you're like the quarterback of the medical team, right? So you need to go fax this specialist and fax this hospital and try to collate all the information. And you spend a vast majority of your time just trying to figure out like what actually happened to my patient since the last time I saw them. And if we can take that burden off of those doctors and we can start to, whether or not that's giving them data products, analytics, like actual predictive data models as we get more advanced. So those physicians now can start to say, okay, let me understand what model is best to apply to this patient or to this cohort or to this population so that I can make some decision moving forward. And that could be at the individual level of understanding like, okay, this person really needs to see a nutritionist. They're at risk of developing diabetes. We got to turn this bus around. And also, by the way, you can use that for patient education because there's tons of patients who care about their weight and getting diabetes and complications from diabetes. But the last thing they want to hear when they go to a doctor is, oh, you need a diet and exercise. Right? Like that's basically useless information. Like everyone knows that. But what does that mean for me as an individual? What diet? What exercise? How much? Where? Right? And like now we can start to say, okay, if I can give you personalized information about what you as an individual should be doing to optimize your health, now we can start to build a care delivery model where we take the data gathering off the physician's plate. We take even probably like patient education, nutrition counseling, all that stuff also off the physician's plate, right? Like you don't need to be an MD to do that. You can start to put together like health coaching, wellness coaching, all sorts of resources around this patient that is data driven because the physician is sitting behind the wheel looking at the data model and saying, this is what this patient needs. And so I think like from that perspective, that's where I see a lot of care delivery going. That being said, I think the interesting piece to that is the bedside manner, right? Physicians right now are basically trained to take care of patients one-on-one, sitting next to them or across from them. And that's not probably going to be possible for the vast majority of healthcare models or visits or encounters that you have moving forward, because there's just straight up not enough physician people to do that for every person. And so now the question is, one, where is it important to have human interaction in the healthcare system? So if you're doing coaching, you're delivering bad news, you probably want that with an actual person and not a bot. But two, when it comes to like actually gathering the data, the decision making, you probably don't need to be in front of a person to be able to do that, right? It's the delivery of that information that requires that human touch. And to your point, it's almost like the customer service consumerism aspect of healthcare, which we're seeing a lot of right now. There's a huge demand in the market because consumerism, that level of customer service has infiltrated every aspect of our lives. I order something on Amazon Prime, it's literally at my door tomorrow, but I want to make a doctor's visit, it takes me 3 months, right? So I think that will allow us to start understanding what are the places that tech can help from the convenience side, the consumer side, the access side. What can data help with when it comes to the actual decision making, the accuracy of treatment matching, of diagnostic support, of predictive modeling, and then what are like the actual operational logistics side of like scheduling appointments? What type of appointments? Can it be in your home? Can it be virtual? Is it in a hospital? And now we start to see, okay, once we have those pieces in place, the physician can truly be the person manipulating those pieces and understanding how they come together in a cohesive care plan for a patient or a cohort of patients. So that's kind of how I see it moving forward. But I guess we'll see.
I see a picture of that for my kid, for my kids. I hope that that is possible. So my question to you is that currently, is anybody, and we don't need to name names, but are we moving towards that, or what is holding healthcare or physicians? Because sometimes it seems like physicians are their own worst enemies too, right? Like you see a lot of them cross their arms and blog and rant online, and they'd say, dismiss good ideas as, well, that's a really good idea, but who has time for that? And then you're like, well, if you keep having that perspective, of course, nothing's ever going to get changed, and we'll continue to roll out the same old physician, shortage data every single year like a show pony and say, look, it's getting worse. But we're so baffled. We're so surprised it's getting worse. And you're like, yeah, but so many of you don't want to change anything because you'd rather dismiss the idea as a good idea, but who has time for that? So where are we making strides, or who needs to start making those strides? Because we've even asked the question like, look, is it physicians? Is it medical societies? Is it groups? Is it, organizations? Is it systems? Where is it? Where should it be? Because I pay my dues every year to these associations and groups, but I don't feel like I have a voice. So I know that's another big ask, but is this going to be possible? I see a picture of it and I hope for it for my kids' future, because I work in healthcare every day on the topic of physician burnout. And it happens to be my seat on the buses in concierge medicine and telling their stories and interviewing folks like yourself that are doing great things that can help patients and help doctors. And so, for the role of what I want to see from my kids, it's got to get better than the way it is right now.
I certainly hope so. I mean, I'm very hopeful as well, but you're right. There are a lot of barriers in healthcare and in innovating in healthcare. One, it's a super regulated space, obviously. And it's also a very complex space, and it probably is going to require innovation across multiple parts of the industry and then actually pulling it all together. And so I do think we're starting to see a lot of that. I think one thing that makes me very hopeful is in the last few years, there's been a big boom in health tech in the startup world, and a lot of the startups have failed, but some of them are starting to create some real learnings and seeing some successes around value-based care, around innovative care delivery models. So like hospital at home is like a big new kind of trend, but I also think it's the idea in the industry of where can we deliver healthcare in a setting that is different from before? Is that on my phone, on my smartphone? Is it telehealth? Is it, at my hospital at home? Is it remote patient monitoring? I think we're actually seeing a lot of those different solutions come to the market right now. And they're relatively very well received by people, like consumers, patients, because we want that convenience, right? Like, why should I have to travel 30 minutes to a hospital to wait 2 hours in a waiting room to see somebody for 15 minutes when I could have probably gotten that on a phone call? And so I think that it's going to require, one, like a really big push from the patient side to demand that innovation. Number two, I think it's also going to require some big changes from healthcare systems. And so we're seeing a lot of this innovation happening in the digital health tech space right now. But when you think about a lot of the incumbents in the space, so we're talking about like large academic centers of excellence, academic medical centers, health systems, those are just really big beasts. It's really hard to get those to change and to move, but you got to start somewhere. And I think kind of starting from this small health tech space area where you can test quickly, try different things quickly, get some learnings, and eventually the things that are successful will bubble up into the big health systems. But you're right. I think it's also hard because we need physicians practicing medicine in the meantime, but we also need physicians on the industry side. And we literally just said there's not enough physicians to go around. And so, I, for one, am 100% very motivated to make sure that physicians are still happy to practice medicine when I'm older and I need a physician to take care of me. But at the same time, like, we do need some folks to come over to the industry side and say like, hey, I have an important voice here. I have the expertise and the business sense to be able to say like, this is what we could build. This is how we would commercialize it. This is why it's meaningful. And it's true. A lot of people are really burnt out in the system. And, it's hard. It's hard to kind of want to pick yourself up again and be like, yeah, let me try again. Let me try to change the system again. But we need more people like that.
Well, and you're the first to involve the patient on the change side. I mean, we've had this conversation in small pockets and in other ways, but I validate your thought there to say, how are we going to change things for the future of our kids and healthcare delivery, and make more doctors data scientists, and then let them become almost the boss, right? And it's like, okay, PA number one, you go over here, you see these 7 patients today, nurse practitioner, RN, specialist, you go over here and do this. And it really is more like that. Now that's a pipe dream, but maybe we'll get there one day. And it sounds like that's where we kind of need to be in order to kind of make that shortage and work, because the shortage is going to be with us for a while. I wanted to unpack the shortage from a Concierge Medicine Today article perspective. So I went back and was like, well, when did this conversation start? And it was in the 70s and 80s. And then it was, then it kind of got bigger. And now it is like a show pony. We trot out the data every single year. And, here's the new set of data. Look how terrible it is. Look what we got to do. And then you hear all the platitudes, and you're actually putting some feet and some fingers to the grindstone, so to speak. I haven't used that in a long time. I haven't even, it just came out of nowhere, but you're actually putting some feet to that. And I appreciate that. And this kind of goes along with the next topic of physician burnout. And by the way, I loved what your Particle Health's website said. It said to enable simple and secure access to actionable healthcare data for digital innovators. Unofficially, we also intend to hashtag destroy the fax machine. And I love that. That was so creative. Whatever marketing guy or you or whoever did that, my hat's off to them, because that was made me smile. And there's a lot to smile about in healthcare. But I remember speaking with a medical professor, and she had taught it. She's still teaching and does a lot, educating a lot of physicians in medical educational centers of places. And she said, not only is it going to take an act of Congress to change how we educate physicians, but it's also going to take an act of God. And I thought, that statement was made pre-COVID when she said that. And then you look at you look at the COVID, you look at what happened in the pandemic, and then you see how quickly a lot of companies adjusted. I remember speaking with an attorney who was one of our speakers at our conference each year, and he said, Michael, did you see how quickly some of this stuff on telehealth happened within 3 months? He's like, 3 months. We've been wanting some of this stuff for 20 years. And they just, kind of almost flipped this switch and was like, they had this stuff ready. Like
Yes.
it's ready, right? So, a lot of this stuff is ready. I mean, I don't have a question here. I want more of your commentary related to, physician burnout pre-COVID. Is it any better or is it worse? Or what are you encouraged about related to the future of healthcare?
Yeah, I think at least one of the elements that you're pointing out here is really around, there is a little bit of a reticence in the healthcare community to make large changes, and like, especially around tech. Like, I feel people, generally, I feel the medical community feels really burnt by a lot of different tech initiatives in the healthcare space in the last couple of decades. And I think COVID is a great one. I was a chief resident when COVID was just taking off. So I was responsible for 70 residents in our internal medicine residency program. And we were taking care of all of the COVID patients in the hospital at that time. And there was this huge debate about, do I need to do a physical exam at bedside? And it's really interesting because when you actually see the way people do physical exams in the hospital, it is bizarre. You're listening to using your stethoscope above like 3 layers of blankets because you don't want to wake the patient up. You're like kind of pressing here, pressing there. It's like, what information are you actually gathering there? Is it useful? And now that we think that the risk is high for you to go into that room because that person has known COVID, how much benefit? And like, okay, if you actually think something is wrong with their lungs, should we just get an x-ray? Should we just go ahead and pull the trigger and say this person needs a chest x-ray? Are you really confident in the way you're auscultating for their lungs right now that you can make a decision without getting an x-ray? So I think there's like really interesting questions that were prompted because of that, and understanding, a lot of people have the questions like, is bedside point of care ultrasound the new physical exam? And so there's a lot of these pieces of technology that are already in existence. They're already around. There's lots of different ways to use them, but there isn't as much impetus to actually change the way that medicine is delivered or practiced at bedside, because change is hard, change takes time, and it takes effort. And if something you're doing right now isn't like definitively broken, it's very hard to push for that change in healthcare, even for something really small. And so, when telehealth first kicked off during COVID, a lot of people were saying, telehealth visits aren't as good. They're dangerous. You don't get to see the person in person. You don't get to do a bedside exam. Like, they're just not very useful. Health insurances didn't want to reimburse for them as a result. And now we do a ton of telehealth visits, right? And at the time, it was like, well, it's better than nothing, which is true. Obviously, it's better than nothing. But it turns out it's basically the same. It's very close to actually our standard of care in person. Are there some things you need to be seen in person for? Absolutely. But the truth is like, it wasn't that different. And that change required a pandemic to
Yeah.
pull through, right? And I think that's kind of your point. Like, as we move forward, like, what are the big things that are going to be necessary to push some of these changes through? And I really honestly think that it needs to come, one, from the consumer demand side, because money is always going to be what moves people. Two, it probably is going to be also on the regulation side. So having to like make some of these law and regulation changes to increase access to healthcare, increase access to health data, get some of these like important things reimbursed in a way that makes care delivery in these models possible and viable. And then I think it's going to take a push from providers to say, look, this is the quality of care that we demand that we give to our patients. And we are unable to do that in the healthcare system right now. And this is what we believe it's going to take. And like, we're willing to like jump in and help with the solutioning, and build towards something that is different, even if it's a little bit scary because it's new.
Well, if these are the types of conversations that you and your team at Particle Health are having, and these are the types of, dinner conversations you have with your peers, then that's amazing. And it's very encouraging because I've worked in healthcare for 24 years as a writer, as an observer, telling stories of doctors. And I asked my kids at last October in front of a group of doctors, I said, do you want to go see the doctor in person? They're like, no, 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 like, and I was like, well, you're going to have to anyway for certain things anyway, but I get it, and then we had some doctors encourage them about, hey, what is the future of healthcare delivery going to look like? And we had some concierge doctors speak to that. And it is hopeful. And so if these are the types of conversations and people and peers that you're having these types of conversations for, it does give me hope as a parent, and also as a patient, and as a sandwich generation, parent too, or whatever guy. But we're now moving into our lightning round of questions because we're coming in for a landing with Dr. Carolyn Ward, the Director of Clinical Strategy at Particle Health. And we'll put the links to Particle Health and what they're doing. But she's a trailblazing internal medicine physician and an advocate for patient empowerment. And so in our lightning round of questions, I have about 6 or 7 questions for you. You can be, since we have about 11 minutes left, I want to make sure that we ask these questions. So you can be however brief or lengthy as you'd like, but bear in mind, I think we got 11 minutes. I want to be respectful of your time and everyone else's time listening. But breaking down the barriers and driving innovation, women in healthcare tech. I don't know the question there, but I think that you need to. I think you have some things you probably want to say to that.
Yeah, I'll say we need more. We need more women in health tech, and we want it to, of course, be an equitable space. But generally, I think it's hard to be in a startup because it requires a lot of time. It can be very demanding work. And I think, from what I've seen, a lot of women kind of shy away from that because, they're kind of told like, hey, you're not gonna be able to have a life. You're not gonna be able to balance your family. You're not gonna be able to do this. You're not gonna be able to do that. And like, I have 2 young kids. They're 2 and 5 years old. And I guess I'm just here to say like, it can work. And so
Wow.
we need more of you guys. We need more people in this space, and we need to hear more diverse voices.
The ethics of artificial intelligence, it's a big thing. Everybody's kind of resistant to it, but then it's like you use it and you're like, oh my goodness, that was amazing. How do they know so much? The ethics of artificial intelligence in health data management, balancing innovation and patient privacy.
Yeah, I would say privacy and security are super important, especially in healthcare data, which is arguably the most sensitive kind of data that we have on ourselves. And I think that that means 2 things. Number one, individuals should, of course, have access to their own healthcare data, and they should be in sole control about who gets access outside of them to their data and what parts of their data. So we need to be really specific about how we allow that kind of data usage going forward. And I think we're very early in that. But also when it comes to AI, the way I use it is, we want to use our powers for good and not evil, but any kind of technology like that, it really depends on who's holding the reins and ultimately what you're building. And we got to be really careful. I think that there is a ton of power here in AI. I think it's absolutely necessary. But again, it's one of the reasons why I think it's so important to have physicians in this space to give that clinical expertise and that patient providing lens to what is being built to make sure that one, what we build is useful, and two, it's not harmful.
Oh. Well, I remember listening to a podcast, and I don't know what it is. I rarely listen to radio. I sometimes will listen to my kids' music when they're in the car, but I find I learned so much from these hyper specific podcasts these days. I'm sure you have your own playlist too, or subscribe to your different ones. Um, but one he approached artificial intelligence and he said, if right now we just kind of need to treat it like it's an intern, like we're still supervising them, right?
Yes.
Like, and once you start using it, you're like, all right, that was like 85% correct. And then next thing you type is like, oh, yeah, that was like 98% correct. And that was like 40% correct. I mean, it's just treat it like it's an intern. If that helps somebody out there, great. All right, last four questions. Either the book on your nightstand or your favorite book that you give away most. What's something that maybe you are reading or you currently read, or you're like, I wish I could get that book into every doctor's hands?
Ooh, that is a great question. So I have kind of a weird one.
Hey,
And yeah,
dental archaeology, it can't be any weirder than that. So,
it is actually a negotiation book and it's called Never Split the Difference. It is really good. One, because I think it's a really interesting read. It's completely outside of our industry. It doesn't really have anything to do with healthcare. And it's from like a CIA negotiator. And he basically talks about the art of negotiation. And a lot of what we do in healthcare actually is negotiation, right? The way we educate patients, the way we speak to people, the way we speak to our colleagues, the way we may negotiate with hospital administration. And certainly on the product side, there's a ton of communication and interpersonal relationships and negotiation that happens. And so that's definitely a read I would recommend to anyone.
well, thank you. I love books that are outside the bubble of healthcare because I find it is like everybody talks about this type of stuff, hospitality, customer service, and then leadership and, negotiation and communication tech strategies. And then you're like, all right, let's push all this stuff inside that bubble of healthcare and see if it'll work. And then you're like, I can't even get them to unlock the door, like,
Yeah.
is there a window open I could just throw a copy in, But all right, well, thank you for that. I'm going to put that on our book list. Um, every day we work in for doctors. We always say it's no longer about being the best doctor in the world anymore. It's about being the best doctor for the world and for your patients and for your local community. And in the space that if I have done anything, I kind of want to be known as the guy who just wrote doctors a bunch of thank you notes over his career, and not even known for working in concierge medicine, but just as known as like he was the thank you. He just sent thank you notes all the time to doctors and nurses and everybody who worked in healthcare. And I think that gratitude is good for the giver. There's science behind that, and there's data on that that's been published. But I think that gratitude is one easily overlooked treatment for physician burnout. And my question for you is, uh, when was the last time you received a thank you note from someone that you work with in healthcare?
Oh, wow. I actually, right before I left my last job at Ford as a primary care physician, I received a bunch of thank you notes from the medical assistants that I worked with. And I think they were all pretty much women who were looking to go to medical school or nursing school at some point. And so we did a lot of like mentoring, and it was just really great working with them. They were like young and ambitious and enthusiastic, and I felt like they really breathed that life back into like the love for medicine. And so I definitely want to say thank you to them. And, they wrote me a thank you note as well. And that was so invigorating.
Well, thank you for that. And our last question for you, well, actually, second to last question. A lot of people will say, what do you want to be known for? And I'm going to ask you the same question. Who are you for? And then it could be, in your work, it could be for your family, but what do you want to be known for and who are you for?
I would say I want to be known as somebody who was curious, like somebody who wasn't afraid to like lean in on unknown areas and just kind of come alongside people who are in that space already and learn like what's going on here. What are the problems? What are the barriers? And to be bold to say like, yeah, I think that's a problem we can fix. No one's fixed it yet, but that doesn't mean it's not possible. It has to be possible to fix it, especially our healthcare system. Like a solution must be possible. And I think when you approach things with that framework, it allows you to be curious to say, all right, so if we believe that we must fix the healthcare system and we must get access to healthcare for everybody in the United States, all right, we take that as an absolute tenet, and now we get to be curious and say, how, right? And I think that kind of attitude is something I'd love to be known for. And then when it comes to like, for who, I would say probably, along what you've said, for my kids. I mean, we want to make sure that we're leaving this planet a better place for our children. And, that comes in a lot of different ways and initiatives. But I think healthcare is a big one, right? I want to make sure we're leaving them a system that is going to give them access to high quality healthcare when they need it, if they need it.
Absolutely. Thank you. Our final question for you is one we ask of everybody, and that is, I'm sure we get the same answer, but it's one of which story do I pick? And that is if you were to like, okay, you know what, that last interaction, that last, that last set of data that came in, that last conversation, that last meeting, that last peer-to-peer interaction, that's why we did this. Like I'm done. Like I can hand over the keys to my department, my role here, and like you'll never guess what happened today at work, honey. What is that story for you that just kind of sticks with you and you're like, that's why I do this?
Yeah, I would say there's probably a lot in a bunch of different aspects. Um, but I will say that I think one thing that has been really rewarding, at least let's go with something similar, like recent, is at my current job, we meet with a lot of different provider groups. And I think one thing that has always made me feel really good is when we meet with a provider group who is like literally doing things so manually. And we're like, hey, we want to come in and help learn about your workflow. Like, how are you getting this data? Oh, you're faxing and printing it out. Okay, great, great. Like, so, and then how do you like move that data and just, oh, on Post-it notes. Oh, you add a Post-it note to it. Okay. And then you're scanning that into your EHR. Okay. Like, and you're like, I can help you with this. Like, this is something that I can solve, that we have solved for people. And so when you get together with that team, you bring in your folks and you're solution designing about, we can solve this problem. We could do a lot more. Like once we get this data into your system, you're going to be able to use it for a lot of different things. And seeing that click for people, especially the providers who are like on the product teams and building towards something, and seeing them say like, yes, this is exactly what we're looking for. Like as providers, we know what it is that we need, right? Like we don't want to be transferring data on Post-it notes. That's just what people feel like they have to do. And so when you see that kind of click with people and it resonates with them and it's what you've been working towards, I feel like that just feels so good. It's like that little shot of dopamine that's like, yes, that's right. That's why I'm coming here to work every day. This is what I'm doing. Like I am trying to solve hard problems for people. And like, we're starting to see little steps and milestones along the way.
Wow. Well, thank you for that. And thank you for your work at Particle and what you're doing in that role as Director of Clinical Strategy. Our guest today has been Dr. Carolyn Ward. She's the Director of Clinical Strategy at Particle Health. We'll put all the links in the show notes of how to connect with Particle and how to connect with Dr. Ward and her team. And thank you so much for what you do. As we say a lot around here, it is no longer about being the best doctor in the world anymore. It is about being the best doctor for the world. And you're truly in your zone. You're in your space, and I can tell that you're passionate about it. And I think it was my guidance counselor in undergrad. He said, you can find a job that you love, but there will always be probably 20% of it that you're like, I didn't sign up for this. Like, this is awful. And this is like the part of my love affair with this job that I just really hate. And we're always going to have those areas in our jobs, but as long as we have a good attitude and write a few thank you notes along the way to those that we work with, we honor those, even if we're leaving, and the job left us, for those who are maybe in that career transition where, what, I'm burned out, I'm frustrated, and I'm considering leaving my current post to where I'm working, we honor the people by leaving and finishing well. I don't know who said that, but it wasn't me. Somebody else much smarter said that. But thank you for being an example to others. And I can't wait to tell more people about you and brag on you and what you guys are doing over there at Particle, because as patients, we're always looking to brag on great doctors. So we want good stories to tell instead of bad ones. So thank you, Dr. Ward, for being with us today.
Thank you for having me.